Now, all this week, we are highlighting the devastating effects long COVID is having on children. Young people have been left disabled, unable to attend school, and many have struggled to access treatment on the NHS.
The government has recognised long COVID is a significant problem, setting up 15 paediatric hubs across the country, including in London, and yet it seems many children are not receiving the specialist care they need to get better.
Well, Stacey Poole has been speaking to families about the struggles they face and asking the long COVID clinics why children are waiting so long to access care.
It took us 6 months of fighting to finally get a diagnosis. It was 6 months of phone calls to the GP, trips to A&E, begging them to take me seriously.
There needs to be more treatments available and more thorough investigations.
There are children still 2.5 years on who are still not any better, and it's not good enough.
All of these families have struggled to access the care that they need for their children. Emily and Hannah lost the use of their legs after contracting COVID-19, and Logan suffers crippling headaches. They've lost months of education, and Emily is now registered as disabled, and yet the families are still fighting for treatment.
There's nothing really in place to support and to treat the children. There's clinics being set up, but the waiting lists for them are ridiculously long.
Children just, to me, feel like they've been forgotten or pushed aside to a certain extent.
The NHS are failing a lot of these children.
These stories are not unusual. Sammy McFarland set up the charity Long COVID Kids after her daughter developed the condition. She said thousands of families are struggling.
The experiences that we're hearing about time and time again is that it's difficult to get care, it's difficult to get a referral, it's difficult to be believed.
On top of that, there is very little in the way of treatment, meaning children are left in terrible pain with devastating consequences.
We have a tsunami of disability of varying degrees throughout, more than 70,000 children currently in the UK. I mean, it's a massive problem.
So why aren't these children receiving the care they need? I've travelled to the Evelina Clinic in London to speak to one of the consultants involved, and I asked her if she's surprised by the number of children who are affected.
I don't think I'm surprised given the number of people that were exposed to COVID during the pandemic, and we know that there was likely to be post-viral illnesses that came about after the pandemic.
Are you surprised by how severely children are affected though?
I think we're seeing a similar severity to what we saw with some post-viral illnesses before COVID. But I guess what we're seeing it is a much larger scale. So that's more shocking, is the scale of it rather than the severity of the illness, because we knew it would potentially be severe for a number of cases.
One of the problems that we've heard time and time again is the length of time it takes to get to the long COVID clinic. Children are waiting 6 months, 8 months, over a year on regular occasions. This isn't good enough, is it?
It's not what we would want to be able to provide. I think it's what we have at our disposal at the moment, and what we do is spend a long time with each individual family. So each clinic appointment is 2 hours with a number of professionals. So finding that ability to manage to do that more regularly is hard.
As you know, the Long COVID Kids charity has done a survey of all of their members, and the response is pretty damning. 73% said they did not feel the long COVID clinics met their expectations. 50% have gone private because they felt like they didn't get the care they needed. And 60% of children that were seen by the long COVID clinics had been admitted to A&E. So it shows the desperate situation that these families were in.
Yeah.
What's your response to this survey and the findings?
The numbers are shocking, and obviously there's a disappointment that people don't feel that they're getting their needs met. So I think we would be open to hearing that feedback and to understanding where can we have influence to do that. But I know that what we are not ignoring is the patient group and trying to reach the needs of those young people, but it probably is an indication of how overworked the system is and overworked individuals are.
I mean, it seems to me that there's a tsunami of cases and we just don't have the system to accommodate all of the children that are affected.
Yeah, I guess that is in some way the case, because we knew that so many people were affected by COVID during the pandemic. There would be a large number affected afterwards. But yeah, we don't have all the answers, and we don't have them yet. But I remain hopeful that, with collective will and, the bigger numbers of families that are now affected, we might start to get some treatments that can improve things.
But all of the children that we've spoken to have already lost more than a year of their lives, some nearly 3, and they're desperate for things to move more quickly.
It's very hard to know what more can be done at this point, because we don't have there's nothing that we're holding back that could be given.
So you don't have the treatment options is really the bottom line?
We have a treatment model that works with the input of different members of the multidisciplinary team that seems to work for a lot of young people, but it's obviously not working for everyone. And what we don't have at the moment is any indication of an evidence base around other treatments that can be more effective.
And this is the issue. There are currently no clinical trials to find which drug treatments work for children who are more severely affected. And until there is very little hope. Jez Medinger has written a book speaking to experts from around the world. He says the UK needs to act now before it's too late.
The long COVID clinics can only work off the research base that exists at the moment. And so until we have those research projects commissioned, performed and then published, the long COVID clinics are essentially operating with their hands tied behind their back, because they have to practice evidence-based medicine. But yet we don't have the evidence base, which is why the government right now needs to be putting money into these research projects. And that's the level of attention that I think we desperately need. And I can't understand why it's not happening.
It feels really frustrating to have been campaigning and lobbying and working at raising awareness of long COVID and trying to improve the situation for almost the entire past 3 years, and really things haven't changed that much.
So until there is investment to find drug treatments that work, these children face a very uncertain future. Stacey Poole, ITV News.
Well, we need to say that we approached NHS England for an interview. Our request was declined. In a statement, a spokesperson said they've invested £90 million over the past year in services for people with long COVID, and that includes specialist hubs for children. They say another £90 million will be invested next year.
They also say they have set out a plan to increase capacity, prioritise treatment and provide better information and support for patients.
Well, on tomorrow night's programme, we're going to be focusing on what's causing long COVID.